Thank you. I just want to tell you that this presentation is very biased, and I'm very proud of that. But
look, can you lower the house lights?
no, well, I think we can still see it. Let's keep people awake. That's more important than seeing things. What I want to talk to you today is about healthcare change that we really need to see happen. We need healthcare program that's simple, not 2,400 pages of stuff. We need a healthcare system that's humane, that reaches out and covers everyone. And we need a system also that's economical, that gets value for our money. That's a part of our American heritage. So let's take a look at these simple premises and try to see what our current healthcare system looks like. We have a conglomerate we call the system. About 60% of it are people who are covered by private insurance through unions, through employers, or through self-purchased insurance. Most of this is for-profit type insurance. We also have the veterans and military and Indian health services and federal clinics. They cover another 4%. This is really a purely socialized medical system. So we have a private system, we have a socialized medical system. We also have 15% of our population, like me, who are over 65, who are part of a single payer system. It's called Medicare. And we also have a system that provides programs for the poor that's operated in cooperation with the states. You've heard about before, which is called Medicaid. And then we have a system that's called out-of-the-pocket model. That means you pay for whatever services are rendered. You don't have insurance, and that's a growing proportion of people in the United States, unfortunately, up to 16 or 17% of our population. But we also have a very large segment of people in the United States who are underinsured. They think they have health insurance until they get sick. When they get sick, they find out they really don't have health insurance. You've probably heard about so-called mini-med policies that are often provided by food service operations, restaurants. They provide $7,000 to $10,000, perhaps maximum, out of insurance costs, and that's very good. That'll cover 1 or 2 hospital days if you're lucky. Well, what has PPACA or the Affordable Care Act really done? Has it reorganized the system? Has it made sense of things? Well, I think it has added a lot to our conversation. It's first of all brought up the issue of health care. It's also focusing on reforming reimbursement and parts of the insurance system. So there are a lot of good things that it does for us, but basically it didn't deal with our health care pie, so to speak. It really is a Band-Aid that pushed those people who are uninsured or underinsured into our current Medicaid sector and into the private health insurance sector through the exchanges. So it didn't really fix the system. We still have a piecework system that has all kinds of ways of provision, as well as a myriad of programs. They include workers' comp, healthcare comp, accident insurance, disability, charity care, all these different categories of services that still occupy our so-called system. We spend a lot of time as physicians just deciding which pile you belong in. And that is very expensive. This system is not simple. We tried every fix the insurance companies will allow, but it still won't fly. Well, this is what our healthcare system looks like. And I'm a pilot, and I don't think this thing will fly. But we did have a great idea. We said, maybe if we make everyone buy tickets, the thing will finally fly. Well, that's not going to happen either. What are we talking about when we talk about improved Medicare for all? What we call, some people call a single payer system. It's a system basically like Medicare. It derives revenue from a system of fair taxation, which, by the way, is perfectly constitutional. Not a problem. We've done it for 66 years in Medicare. It also sets up standard payer rules, that is, universal rules that apply to everyone equally. And it pays private healthcare providers for services that they provide. So it's a publicly sponsored, privately provided set of services. It's a very simple, straightforward system, and it has worked for those of us who are over 65, again, for a number of years. It provides universal coverage. We actually get more choice of doctors and hospitals. We have a fairly comprehensive set of benefits, but with improved Medicare for all, we'd like to see those expanded. Well, we need a system that's humane. One of the big problems we've seen is that the number of uninsured has increased over time. If you go back to 1976, we really didn't have that many people who didn't have some form of insurance. I mean, we've gotten much worse. But under PPACA, we still are going to leave more than 20 million people uninsured. So I think that gets us back to maybe 1980 or 1985, something. So we're making real progress. We're up to 1985 now. We also know that when people don't have insurance, they're at much higher risk of health problems and death. The best estimate of excess deaths related to not having insurance at a point in time is that it's almost 45,000 excess deaths that occur in our country because of this lack of insurance. New Jersey, it amounts to a little over 1,000 deaths, probably a little bit higher now with the current population. Well, PPAC is going to reduce the number of uninsured, but we still are looking at 22,000 excess deaths annually due to lack of health insurance. This is probably the most inhumane type of rationing that any developed country has initiated. What other country allows 22,000 people to die each year for lack of access to health care? We ration people by ability to pay. Healthcare is a right, says T.R. Reid. All the other developed countries on earth have made a moral decision. All the other countries like us, that is wealthy, technologically advanced, industrialized democracies, guarantee medical care to anyone who gets sick. We still have not made that decision. PPACA is a step in the direction. It certainly increases the number of people insured, but we still have not made the moral decision that health care is a right in this country. One of the important factors, though, that we're learning and looking at systems with universal health care coverage is that universal coverage is actually the most cost-effective way to deliver health care. This fragmented system that leaves people out is actually much more expensive than providing care to everyone. And we can see that medically as physicians. When people drop in and out of the system, they become very high-risk patients. They're much more expensive to manage, and they become very difficult patients for the healthcare system to deal with. When we look at comparisons internationally, in terms of quality, other industrialized countries produce better results than we do, or the same, for half the cost. Every other rich nation's healthcare system is actually cheaper than ours. The nearest runners up, countries like Switzerland, others are still cheaper than we are. Choice. The striking fact is that many countries provide more choice than most Americans have. We have defined choice in this country as choice of insurance company. That's not real choice. What we want is choice of provider, of physician, of hospital. A single payer system allows a national network. That means every physician in the United States becomes a part of the network. It gives you universal choice. For physicians, it's also a major problem because dealing with this fragmented system leaves us very unsatisfied. We're in the lowest quartile internationally in terms of of physician satisfaction with the practice of medicine. We're also in a position where insurance restrictions on medication or treatment for patients pose major time concerns for doctors. We have the greatest concern for not being able to provide care for our patients because of health insurance restrictions. Well, we need a system that's economical. We all know that the U.S. leads in many areas, and we certainly lead in the area of healthcare costs. We've managed since the 1970s to break away from the pack and lead the world, both in the rates of increase and the absolute value or costs of healthcare in the United States. If we look at our healthcare costs, they tend to be almost double of most other countries. And if we even look at just our insurance costs, our tax costs, the taxes we pay for healthcare are actually higher than the total cost of other healthcare systems. In essence, we pay for a national health program, but we don't get a national health program. So why does this system cost so much? Well, there are a lot of different factors that lead to high costs. But one of the factors that we don't often look at, and it's not really broken out separately as a total entity, is the private insurance bureaucratic overhead. But this is a larger number than is usually looked at. It's not just the cost of overhead from the insurance companies. It's also costs that are driven into physicians. If we look at our overhead costs from Medicare, commercial carriers, investor-owned blues, and other types of things, we can see that a single payer type system has a much lower overhead cost rate. But again, that's not the only part. As physicians, we have to bear a huge cost dealing with all these hundreds of different insurance plans. The most recent estimate is that the total annual cost per physician is nearly $70,000 per year in dealing with insurance companies. That's money that is not available for patient care. It's strictly money that goes for bureaucratic overhead. If we look at the growth of administrators in healthcare, this has certainly been the greatest opportunity for employment in the last 30 years, almost a 3,000% increase in administrative personnel related to healthcare. These include utilization review, care management. I added about 300 jobs to this group in our healthcare management company. So we've seen a huge growth in administrative overhead. So if we look at all of these overhead costs, our current system has almost over $2,000 per person in overhead costs. That's about 31 cents out of every healthcare dollar. That means 31 cents provides no health care at all. With Medicare For All, we could reduce that cost probably down to around 13 cents out of every dollar. This is a savings of over almost $1,200 to $1,300 per year per person for every living soul in the United States. This amounts to some 350 to probably currently about close to $400 billion a year in excess overhead costs. So money is really not the issue. We waste enough money on healthcare overhead to provide quality coverage for every person in the United States with a system of improved Medicare for All with low overhead costs. And this has been shown over and over again. There are 19 studies over the last 20 years, both at the state and federal level, that have shown that single-payer systems operate more efficiently, that the reduction in overhead costs can provide coverage